Get your patient's consent to perform cupping. Make sure your patient is aware of the pain and bruising associated with cupping before they consent to treatment. The hot cups hurt when they are in contact with the patient's skin, and cupping leaves circular bruises that are tender, painful, and last for a week. Identify the area on the body that you want to treat. Target the place where the patient is experiencing pain. The back, arms, and legs are ideal treatment areas. Don't do cupping on the face or genitals, feet, or hands. Also avoid any ulcers or deep vein thrombosis. It's too dangerous to cup in those spots. Wash the treatment site with soap and water. Use a wet, soapy washcloth to thoroughly wash the area of the body that you're going to treat. Rinse off all the soap with some water, and then dry the treatment site with a clean towel. Rub lotion into the skin. Smear a small amount of lotion over the intended treatment site and rub it in. The lotion will make it easier to move and reposition the cups during treatment. Wash the cups with hot water and soap. To make sure your cups are clean before you use them, wash them with hot water and soap. Cups used for cupping are generally glass, and hold about 2 to 4 fluid ounces. They're also usually dishwasher safe, so you can wash them in the dishwasher if you have one. Soak a cotton ball in rubbing alcohol. Grab a sterile cotton ball with long medical tweezers. Dip the cotton ball into a dish of rubbing alcohol, allowing the alcohol to soak all the way through it. Hold the cotton ball with tweezers and light it on fire. Hold the cotton ball with the long tweezers. Using a lighter or candle, carefully light the cotton on fire. Make sure you do this away from the dish of rubbing alcohol, to avoid setting the dish on fire. Hold the flaming cotton ball inside the cup with tweezers. Take the cotton ball out of the cup after about 3 seconds, or when the glass feels warm. The flame will suck the oxygen out of the cup and allow it to suction to the patient's skin. The glass should still be cool enough to hold in your bare hands. Press the opening of the warm cup onto the skin. As soon as you remove the burning cotton, invert the glass and place it onto the skin over the target area. After a second, let go, and the cup should stay on the skin. As the glass cools, the space inside transforms into a vacuum. This vacuum creates enough suction to hold the cup in place. Work with one glass at a time until you've placed them all. Warm each glass using the burning cotton, then invert the glass and place it on the skin. The cups should be spaced out over the treatment area, a few inches or centimeters apart. Continue until all of the glasses have been placed. Extinguish the fire. Once you've warmed and placed all the cups, extinguish the flaming cotton ball by dropping it into a fire-resistant container. Cover it with a lid, and the flame will go out. If the flame is quite small, you could also blow it out, or dunk it in water. Leave the cups in place for 10 to 20 minutes. Keep the cups on the skin for about 10 to 20 minutes, until the skin beneath them begins turning from red to violet. Remove the cups by simply lifting them off with your hands. If the suctioning becomes too painful for the patient, remove the cups early. Seek medical attention if bruises last more than a week. Cupping almost always results in circular bruises. In most cases, the bruises caused by cupping aren't too painful. They should disappear within 3 to 4 days without additional treatment, but they can last up to a week. If the marks don't fade after a week or get worse during that time, consult a doctor. Cover any blisters with moleskin. In rare instances, cupping can create mild blisters. To protect the blister while it heals, use a blister-protecting adhesive pad, called moleskin. Cut a hole in the moleskin so that it's a donut shape, and place it over the blister. This way clothing won't touch or irritate the blister while it heals. Have your patient hydrate well and be wary of strenuous activity. After cupping, It's important to hydrate to help the body with its recovery process. Have your patient drink lots of cool water. Some people recommend waiting a bit before strenuous exercise after cupping, but some athletes like to do cupping right before a big event. Make sure your patient avoids excessive heat for 24 hours after cupping. Saunas, hot tubs, and sunbathing can make the cupping bruises hurt, so tell your patient to avoid these. Excessive heat can also prevent the bruises from healing quickly. Use cupping no more than once a week. Cupping can be used regularly, but too much can be bad for your health. Start using this treatment only once a week, and increase to a few times a week only if it feels right for the patient. Remember to only leave the cups on for about 10 minutes or fewer during each cupping session.